Hello, so today we'll be talking about range of motion exercises for the upper body. So, what you want to do first is before you go to your patient's room, you wash your hands, you gather your supplies, then you knock, and after that, you ask if you could come in, and if they say yes, come in. Then from there, you want to introduce yourself and you want to check their ID to make sure it's them who you're supposed to be working with. Um, After that, you want to make sure you close the curtains to give them privacy, and you want to lower the head of the bed, and lower it as much as possible, um, or you want to lower it as much as possible, or as much as they could tolerate. You want to have them laid down in the supine position, which is on their laying them on their back aligned. You want to start with. You want to make sure you lock the wheels so the bed doesn't move. Higher the bed to about waist high so you won't be hurting your back. From there, you want to start at the shoulder exercises. So you'll start with the flexion and extension, and you'll be doing about 5 of these. So with that, you'll start with one hand on the wrist, and the other one under the elbow. And then you want to make sure the palm is facing down. So pretend I'm laying down, and of course you want to keep them covered. Um, that way they're not exposed. But anyway, so they're facing, the palms is facing down, and then you just want to have them lift up over the ear. So you do that. So you do that, and you do about 5 of these. So that's 3, 4, and I think this is 5. And then from there, you want to go to the abduction and adduction. An easier way for me to remember this is abduction is like you're getting abducted by aliens, so you're going away. They're taking you away. So you're gonna be going uh, abduction, then adduction, because you're adding the arm back to you. Or you could also remember like abduction, like you're taking their arm towards your abdominal area, and then you're adding their arm back to them. So abduction, adduction, and you'll do 5 of these. And I think not I think, but you want to have the arm on their side and then the palm facing up. So abduction, adduction, abduction, adduction. So you want to do these about 5 times. So this is 1, or actually, I guess, yeah, that's 1, 2, 3, 4, 5. And then you want to do the horizontal abduction and adduction. Sorry, it's a tongue twister for me. So you want to have their palm up, and then make sure while you're doing these exercises, you keep on asking them if they're comfortable, because you don't want to keep on hurting them, or sometimes they can't speak, so you don't know if they're hurting. So make sure you check for cues, like if they're making a face or like they're like holding back from doing it. So the horizontal abduction, adduction, you want to have their palm facing up, and then you want to hold their arm away from the body, and then you want to cross it. Okay? So abduction, adduction, abduction, adduction. All right? And you want to do about 5 of these. And again, make sure you ask them if they're comfortable, if it feels okay. Okay? Away from the body. Palm up. And then you go like that. And then make sure you're holding their elbow and their wrist when you're doing this, because you don't want them to be like hurting themselves either. And then now, after that, you do 5 of those. You do the rotation. So the rotation, you want to have their arm like that. Pretend again they're lying on their back, and then this is shoulder length. And then you want to, it's called rotation. So you want to, so you want to pretty much, I guess it looks like a stop sign. So you go like that. So pretend I'm laying down. So you just want to go like that. Like a stop sign. You know the signs you learn when you're taking your driving test? So stop. So make sure you do about 5 of these. All right. So now we're going to be working on the elbow area. So that was the shoulder. Now we're moving to the elbow, and we are going to do the flexion and extension. So they're going to look like you're doing curls with your palm up, right? And again, always help them out and keep on asking if they're doing fine. And you're going to do 5 of these. So you're going to do flexion, flexion, and extension. Flexion and extension. Flexion. Way I remember is when somebody's trying to flex, so you're moving your arm towards you, and then you're extending it. So flexion, extension, flexion, extension. And you want to do 5 of these, but with the palm facing up. So you're going to hold them like that. So I'm laying down. My arm is on the bed. My elbow's on the bed. All you're doing is moving the forearm and your hand, or their hand, their forearm and their hand, towards their body, away from the body, towards their body, away from the body. They're flexing to show their biceps. Now they're relaxing. Okay, so now we're going to do the I forget how to say this name. Pronation, I believe it's called. Pronation and supination. So that one, they're laying down, and pronation is when their palm is facing down, but you're gonna still have their arm like this. So pronation, supination, pronation, supination. Okay, it's like doing the princess wave almost. Yeah, but of course you're gonna not do it this fast either. You don't want to hurt them, and by not hurting them, also you're gonna keep on asking them if they're doing all right. So pronation, supination, and you're gonna do 5 of these, and then you're gonna do the flexion and extension. So for this one, you're gonna flex down and then extend up. Flex down, extend up. Or another way to remember this, how I ended up remembering was because my instructor calls it the hey girl, hey. So hey girl, hey girl, hey girl. So flex, extend. All right, and you're gonna do 5 of these. And again, you're still gonna keep their arm like that, and you're gonna work on this now. Or their wrist, I should say, sorry. So this is their wrist. Okay, now you're gonna do the radial and ulnar deviation. So for this one, you're gonna have to remember where your radius is at and your ulnar bones. So one way to remember is the radial is towards your thumb and ulnar is towards your pinky. So pretty much you're just gonna have them move towards your pinky or towards their thumb, away from their thumb and towards their pinky. So you're gonna move them like that. And you wanna do about 5 of these. Okay. And keep on asking him, her, they, if they're hurting, if everything's okay. You know, you don't want to hurt them. Some of these patients have arthritis, so you want to make sure you're careful. So move towards the thumb, move towards the pinky, towards your radius, towards your ulnar. Alright, so now we're going to be working on your fingers, the fingers and thumb, the flexion and extension of your fingers. So, excuse me. So what you want to do is you're going to touch each finger one by one towards your palm. You're going to be doing that. And then you're going to extend each finger one by one. And then that one. And so you're going to do this about 5 times. Okay? So you flexing the fingers in towards your palm, towards their palm, including the thumb, and then you're extending them away from the palm. You're going to do about 5 of these. So now we're going to do the abduction and adduction of the fingers. So you want to start by keeping the index finger and thumb together, and having the middle finger, the ring finger, and the pinky moving away. So abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. And you want to do about 5 of these. All right? So abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. And then just do about 5 of those. All right? And then now you're going to do thumb flexion and extension. So you want to bend the thumb towards the palm by where the pinky is, and then you want to position it back to the natural position. So towards the base of the pinky, now away. So flexion, extension, flexion, extension, flexion, extension, flexion, extension. All right, so you're going to do 5 of these, and make sure you're asking the patient if they're feeling okay. If you want to make sure you're not hurting them. Now, the thumb up position is where you touch pretty much from your thumb to each finger. Well, you help them touch each finger. All right. And you're going to do about 5 of these. All right. And after you're done with that, you just want to put them back to how they were. You want to make sure their body's aligned, cover them up. You want to make sure you lower the bed for their safety, make sure the wheels are locked, make sure you open the curtain back, you clean your station if you made any mess, you wash your hands. Oh, make sure you give them I forgot what's it called. They're pretty much the control in case they need to call you. I think it's called light control or control collar, light collar. But make sure you give them that and let them know that they have it by them. Let them know where it's at. And make sure the rails are up. Their bed is lowered, their position, if they were positioned, I guess, with their head a little bit tilted up, you put them back like that. Or unless they want to be in different position, you can put them in different position. Again, you make sure the wheels are locked, you open the curtains, you clean your mess, you wash your hands, you record and report, and that's about it for the range of motion exercises for your upper body. Thank you.